Welcome back to another Bestie video, viewers! Have you ever experienced tingling or numbness in your hands that's gotten better or worse with time? You may be dealing with carpal tunnel syndrome. Carpal tunnel syndrome, or CTS, affects around 3% of adults in the US. This happens when a nerve in your wrist is pinched as a result of everyday activities, like playing a musical instrument, doing manual labor, or typing for long hours on your laptop. The symptoms develop gradually, and if not handled carefully in time, it can worsen the pain and may cause movement-related issues. If you are experiencing mild to moderate symptoms, then recognizing them and taking strict measures will help you realize that there is some light at the end of this tunnel. Here are the 9 ways to tackle carpal tunnel syndrome. Number 1. Wrist splints. A wrist splint looks like a fingerless glove that helps in stabilizing your wrist. This non-surgical treatment plan has proven benefits. It helps in minimizing the pressure applied on your nerve and enables your wrist to be in a state of some much-needed rest for a while. This is done to stop your wrist from moving. Not just that, a wrist splint also reduces pain while sleeping. Remember not to wear splints while performing everyday chores, as it'll put unnecessary strain on your arm. Splints are a short-term treatment plan for carpal tunnel, since long-term usage will weaken your muscle. Have you been experiencing some discomfort while carrying out housework? What did you do about it? Tell us all about it in the comments. Number 2. Choose a healthy lifestyle. A healthy lifestyle change is always a problem solver. Identify the habits that are contributing towards your CTS and try to avoid them. You should also get the right amount of exercise every day in order to maintain an ideal body weight. Remember to also eat highly nutritious meals, since that contributes to your exercise goals. If your work involves a lot of typing, then you should adjust your posture by relaxing your shoulders, keeping your wrist straight, and placing your arm higher than the wrist. All these everyday tweaks will help in alleviating the pain. Number 3. The hot-cold therapy. You must be familiar with the magical benefits this pain-relieving treatment has. The hot and cold effect on the arm muscle reduces pain by eliminating inflammation. You can use a simple ice pack from your refrigerator and a cloth dipped in hot water. Doing this for 15 to 20 minutes will provide you some temporary relief. Always use a towel to protect your skin from burning. This therapy is also used by serious sports athletes. The best part? It's a reliable, cheap, safe, and simple hack that can be done anywhere at any time. Number 4. Stretching exercises. Carpal tunnel syndrome is the result of a compressed nerve median. Stretching it out will give you some much-needed relief. Exercising the wrist gently will stretch out the nerve and relax it. The exercise should be focused on the joint of your wrist, like stretching out your fingers or pulling your fingers in a downward and upward manner. Something like the stretching you do for a workout before exercising. Carpal tunnel exercises have proven to help a mild to moderate grade of symptoms, but you're gonna have to combine these routine wrist exercises with other changes in your lifestyle, like eating healthy and exercising regularly. Number 5. Make your workstation comfortable. As the world goes online, the chances of people developing CTS has increased tenfold. Although continuous wrist motion is not the direct cause of carpal tunnel, it increases the risk. Try to get rid of that uncomfortable office chair and make your workspace more efficiently designed by opting for the ergonomic option. This will also mean maintaining a neutral position for your wrist while typing or using the mouse on a chair that properly supports your back and arms. Make sure that your wrist is resting comfortably just in front of your keyboard or mouse. These small changes will result in long-term pain relief from carpal tunnel syndrome. Number 6. Elevate hands and wrist while sleeping. Did you know that the wrong sleeping position is another one of the most common causes for carpal tunnel? The solution to this is to prop your palms and wrists on top of small pillows or cushions on either side. Of course, this sounds uncomfortable, but is successful in getting rid of the pain from your wrist. This is an effective remedy which works by reducing blood flow in your wrist, allowing you to sleep peacefully at night. Easing inflammation is the primary goal for getting rid of the pain caused by CTS. If your pain is extreme, then you can also tie a bandage around your elbow. Number 7. Over-the-counter pain relievers. CTS commonly occurs in people who do hard manual labor for a living. In cases where you're not able to rest, pain relief ointments or sprays should be in your backpack. It's a convenient solution for a problem that can't be predicted. The chemicals allow the nerve to cool down and provide some much-needed quick relief. They're also a good alternative if you don't wish to take medication. These pain relievers can also be used for relief from sore, aching muscles, and painful joints. Number 8. Choose nutritional supplements. The world is finally recognizing the benefits of organic and nutritionally rich foods. CTS can be an indication that you need to make some major changes in your lifestyle, especially with your food options. If it's not possible for you to make the switch to organic meals, then opt for nutritional supplements. The next time you're at the supermarket, make sure to get some supplements for vitamins, omega-3 fatty acids, and antioxidants. They work towards reducing the pain and inflammation from CTS. Number 9. Acupuncture therapy. Acupuncture is a 3,000-year-old technique that's used to relieve pain. It promotes self-healing by increasing stimulation when pressure is applied to specific points in the body known as acupoints that are present at the intersection points of two nerves. The stimulation techniques consist of manual massage, heat therapy, application of herb-based oils, and cupping methods. Apart from carpal tunnel syndrome, acupuncture also provides relief from conditions like hay fever, headache, knee joint pain, hypertension, tennis elbow, and many others. The stimulation effect is directly linked to resolving pain, improving sleep, and an overall sense of well-being. Have you been feeling overwhelmed lately? Work-life balance a mess? Watch this video showing the symptoms of chronic stress on your body and how to make the necessary changes. Now back to 9 ways to tackle carpal tunnel syndrome. Number 10. No more flexing. The problem area of CTS is the wrist. Don't even think about carrying heavy stuff or flexing your wrist all the way up and down. Give it a rest. While on one hand, light wrist-friendly exercises are encouraged, taking it too far will only worsen the situation. If you're experiencing the symptoms for CTS, then you should decrease wrist motion. This means saying goodbye to the gym or taking a day or two off from work for the time being and giving your body time to recover. Number 11. Get medical help. If any of the tried and tested methods don't work, then maybe it's time for you to speak to a doctor, especially if it's your first time experiencing this syndrome. The doctor may inject a corticosteroid into your wrist near the carpal tunnel for quick pain relief. Injections have proven to be more effective when compared to tablets that may also give some unpleasant side effects. The effects of this injection last for up to 10 months, which gives you enough time to get rid of the symptoms altogether. Number 12. Manual massaging. This holistic approach through massage began 5,000 years ago. Massage therapy is one of the most effective ways to relieve yourself from the symptoms of CTS like numbness, inflammation, and pain. Going for a deep tissue massage will help in stimulating the trigger points and eliminating the tension present in soft tissues in the hand, wrist, and shoulder. The relief comes from lengthening the muscles in the affected area. The primary focus is to reduce the muscle tension, and a good massage therapist will help the mobility of your wrist. Number 13. Reflexology. Reflexology is another holistic approach towards relieving pain related to carpal tunnel. It's based on the theory of applying pressure on your hands and feet, making it a very different type of massage therapy. This method will unblock the joints and release the pressure on the nerve. Reflexology has many benefits for treating underlying conditions by improving your blood circulation, especially in the case of stress, anxiety, soreness, or tightness anywhere in the body. Keeping a positive mental attitude works as a catalyst to alleviate the pain and show welcome results in the long run. Have you ever had joint and muscle-related injuries? How did you find relief? Comment below and tell us about your experience. Enjoyed this video? Hit like, share, and subscribe to Bestie. Wait, what kind of bestie are we if we don't tell you about our other awesome videos? Go ahead, choose the left or right video and enjoy.